Hey guys, what's up? I hope your week is going well. So in today's video, I wanted to cover a topic that I get questions about all the time from my female audience in particular, and that is, can I go over hormonal therapies for hair loss? I have several videos talking about male and female pattern hair loss. And so in today's video, I'm going to talk about some of the hormonal treatments like spironolactone and FINASTERIDE that you all have asked me about for female pattern hair loss. If you're not familiar with female pattern hair loss, it is the most common type of hair loss in women. And it gets kind of lumped into the same category of hair loss as male pattern hair loss or male pattern baldness. This is a condition otherwise known as androgenetic alopecia. Androgenetic because there's a genetic tendency to develop this, and androgen, it's thought that a key part of what causes this type of hair loss in both men and women is a sensitivity of the hair follicle to the male hormones, the androgens that we all have, both men and women, in our body. Some people have a genetic tendency in their hair follicles to be very sensitive to circulating androgens in the body, and as a result develop thinning of the hair. What happens in female pattern hair loss is that over time you have a reduction of the number of hairs that are in the actively growing phase of the hair cycle. And many of those hairs are then shifted to a resting phase. They are told to stop growing. And what then happens is that those quiescent hairs turn into baby hairs. They become miniaturized. And that results in the appearance of thinning. The pattern of thinning in female pattern hair loss tends to localize on the vertex of the scalp and present as a widening of your central part. And it can present gradually over time. Again, there's a genetic tendency towards this, and it appears to be influenced by the male hormones in our body. But interestingly, in female pattern hair loss, it seems that androgens are not solely responsible for this condition, and there are likely other contributing hormonal factors playing a role for which we have not completely worked out the details. But we do have a lot of evidence that androgens in women, at least, may not be fully responsible for this type of hair loss, because there is a condition known as androgen insensitivity syndrome, in which individuals are born without the receptor to detect androgens, and those individuals can still develop androgenetic alopecia. Those individuals lack the ability, the cells in their body lack the ability to see and respond to androgens, to the male hormones, yet they still develop this hair condition, So it suggests that there are other hormonal factors going along to contribute. In both men and women, however, it is a very, very frustrating and emotionally devastating thing to cope with. The gradual thinning and loss of your hair over time has profound impacts on your emotional health and your overall sense of self. First-line treatment for both male and female pattern hair loss, which is FDA approved for hair loss for androgenetic alopecia, is going to be over-the-counter topical minoxidil. I have videos talking about this. It's not the most enjoyable thing to have to comply with, as you know from those videos. It can be very drying, very irritating, lead to an itchy scalp, and it's something that you have to do on a daily basis to maintain the hair growth. And so it's difficult to comply with and not something people necessarily are excited about. There are also many systemic medications that can be considered, and I will talk about in this video, for androgenetic alopecia. First up is a class of medications that inhibit the enzyme that convert testosterone to a more potent form of testosterone, known as dihydrotestosterone. This class of medication is known as 5-alpha reductase inhibitors. And many of you watched my video on finasteride, and in that video it was largely directed at my male audience with male pattern hair loss, but I got many questions from my female audience. Well, is this something that could be used in female pattern hair loss? So finasteride, which goes by the brand name Propecia, is FDA approved only for male pattern hair loss. It is not FDA approved for female pattern hair loss. We do not have nearly the body of data regarding safety and or efficacy for finasteride in women as we do with men. So it's a little bit difficult to be as confident in finasteride for the treatment of female pattern hair loss. But we do have studies showing that it is helpful. The issue with finasteride, brand name Propecia, is that it is what's considered teratogenic, meaning if you become pregnant while you are on this, it has devastating consequences to the health of the fetus. So the effects on a developing fetus are obviously of concern in giving this to women, but a theoretical concern, although not substantiated by medical evidence, just a theoretical concern, is that if you recall, finasteride, brand name Propecia, works by inhibiting the conversion of testosterone to the more potent form dihydrotestosterone. And so as a result, on Propecia, finasteride, what happens is that you have increasing levels of just testosterone. And theoretically, that could put you at risk for breast cancer. We don't have epidemiologic data to support that, to show that it does put you at risk. It's merely a theoretical risk and something for hair loss, we're going to be more resistant to consider. But finasteride is not completely off the table as a treatment option in some patients with female pattern hair loss. The evidence to support its use and efficacy in women with female pattern hair loss looks at a variety of doses. In doses of 1 milligram per day, that's a very, very low dose. It doesn't seem to be particularly helpful for female pattern hair loss. Looking at doses of 2.5 milligrams per day, so sort of middle of the road, in combination with a oral birth control pill, does seem to be helpful in restoring some hair growth and hair thickness and hair density. And then doses of 5 milligrams daily have been shown to result in increased hair thickness and hair density. So it's something that your doctor may discuss with you, but bearing in mind, there are obvious concerns around pregnancy and this theoretical risk of potentially, although not substantiated, increasing the risk of breast cancer. But finasteride is not the only medication in this class, the 5-alpha reductase inhibitors, which I'll remind you are medications that block the conversion of testosterone to the more potent dihydrotestosterone. Another medication similar to finasteride is one called dutasteride. Goes by the brand name Avodart. Avodart is actually 3 times more potent as a 5-alpha reductase inhibitor than finasteride. And we do have a study showing that it actually might be even more effective than finasteride. But again, the same concerns. It is pregnancy category X, which means absolutely contraindicated in pregnancy. So it's going to be met with concern. But with both of the 5-alpha reductase inhibitors, finasteride and dutasteride, honestly, pretty much all of the data that we have in androgenetic alopecia is looking at men. And so what that means is we simply don't have the large-scale or epidemiologic data to make us feel super confident of the safety of these drugs in women. And given the concerns around pregnancy category, it's generally not going to be the first-line consideration for a systemic agent. Moving along to other treatments for female pattern hair loss that are hormonally based would be medications in the class known as androgen receptor blockers. These block the interaction of testosterone and dihydrotestosterone with the androgen receptor, so they make it so that the cells in the hair don't see these hormones. And one medication in this class that I have another video on is spironolactone. But spironolactone is an androgen receptor blocker medication. It's actually a blood pressure pill, but it also works to block at the level of the androgen receptor. And we use it in dermatology at very low doses to treat some of the skin and hair manifestations of androgen excess, like hirsutism, or growth of hair on the face in women, as well as acne. It's frequently prescribed for acne. But it has also been examined in the setting of female pattern hair loss and is shown to be effective at low doses of 100 to 200 milligrams daily for female pattern hair loss. So this is another potential option. I think many of you asked me about this in my spironolactone video. I can't quite remember. There are some side effects associated with spironolactone. I'll preface the side effects though by telling you this. In dermatology, they are not as common because we use doses of the medication that are much lower than would be used to treat high blood pressure. And the side effects are something that are easily monitored for. These include things you might expect, a little bit of breast tenderness, spotting in between the periods, so menstrual spotting, some irregular menses. Honestly, that tends to stabilize after you've been on the medication for a while and go away. Same with the breast tenderness. And then the other thing that can happen is you can develop a little bit of dizziness if you go from lying down to standing up too quickly. It also will make you visit the ladies' room a little bit more often to relieve your bladder. So be prepared for that. Maybe 1 or 2 extra trips to the bathroom in a day. And the other more concerning potential side effect, although not very common, is electrolyte abnormalities. This medication can put you at risk for high levels of your potassium levels getting too high. And honestly, in otherwise healthy women who don't have any kidney problems, very, very rare, but definitely go over your medications with your doctor, if you're considering this, because certain medications also can interfere, certain other medications you might be on can also interfere with how potassium is regulated in the body and put you at slightly even more risk for that. So definitely something to go over with your healthcare provider, but honestly, in my experience, very low likelihood issue in otherwise healthy women. Another medication, though, in the class of medications known as androgen receptor blockers, meaning those that block the interaction of testosterone and dihydrotestosterone with the androgen receptor to keep these cells from actually seeing that hormone, is a medication called cyproterone acetate. I got many questions about this. It is one that competitively blocks specifically dihydrotestosterone at the level of the receptor to the target tissue. And it lowers testosterone by also decreasing the release of other hormones from the pituitary in our brain that tell our body elsewhere to make testosterone. So it works in a couple of different ways. We have a study of women taking this medication for 12 months with a birth control pill in comparison to women taking a birth control plus just using minoxidil, brand name Rogaine, which showed that actually cyproterone is not any better than minoxidil in these women. But it is a medication that is used honestly more in Europe and Canada. We don't use it here in the States. I don't have any experience with it, but it is something that has been shown to be effective in certain situations and is sometimes considered. Side effects of this medication include weight gain. It too can make for some breast tenderness, and it can lower your libido. And probably the more concerning side effect is going to be that at higher doses, 25 milligrams per day, it does put you at risk for liver toxicity, as well as something called meningiomas, which are little kind of cysts on part of the brain. Again, it's more widely used in Europe and Canada. Another drug in the class of androgen receptor blockers is one called FLUTAMIDE, and it has been shown to be effective for female pattern hair loss in individuals who have evidence that they have hyperandrogenism. So interesting about female pattern hair loss is that while conditions that are associated with high androgen levels obviously are a risk for this, the majority of people who have female pattern hair loss do not have hyperandrogenism. They don't have other signs of hyperandrogenism like cystic acne and hirsutism. But there are a subset who obviously do, and in those individuals, FLUTAMIDE has been shown to be helpful. And FLUTAMIDE also has the adverse side effect of toxicity to the liver. And so your liver function tests have to be monitored while you're on the medication. Now that I've gone over the 5-alpha reductase inhibitors, finasteride and dutasteride, as well as the androgen receptor blockers, spironolactone, CYPROTERONE, and FLUTAMIDE, the third class of medications that I will talk about today, for which you have asked me about, are oral contraceptive pills. Are they helpful? Oral contraceptive pills that contain estrogen, do they help in female pattern hair loss? And the answer is they seem to be. Estrogen at the level of the hair follicle is theorized to be protective against female pattern hair loss. And the evidence in support of this theory is that throughout a woman's lifetime, in situations where she may experience a bout of lower estrogen, these are time periods where female pattern hair loss often can begin to manifest, such as around menopause, as well as during postpartum after pregnancy. And in the unfortunate situation, if you should ever have to undergo therapy for breast cancer, the medications for breast cancer work by blocking estrogen and estrogen signaling to prevent your tumor from responding to it. And then they subsequently lower estrogen and estrogen signaling in the body. And those medications can set the stage for kicking off female pattern hair loss. And estrogens estrogens and oral contraceptive pills work by a variety of mechanisms in the body to lower the overall availability of free testosterone in the body. They work by increasing something called sex hormone binding globulin, which is a protein that binds up extra androgens, extra hormones in the body, and kind of hides it from the receptor. So it decreases the amount of available testosterone for your hair follicle to see and subsequently become miniaturized by. It then also works, these medications also work to quiet down signaling from your brain to other organs in your body to make testosterone. So it decreases the release of something called luteinizing hormone and follicle stimulating hormone. So that then quiets down the signal to tell our body to make more testosterone, more androgens. And it also lowers, our ovaries secrete some androgens. Oral birth control pills lower secretion of androgens from the ovaries. So in effect, oral birth control pills can lower the quantity of free available testosterone in your body that could affect the hair follicle. Also, oral contraceptive pills are going to be often co-prescribed along with some of these other medications I mentioned, because all of the other medications that I mentioned are contraindicated in pregnancy. Spironolactone, you frequently are advised to go on an oral birth control pill that is frequently prescribed. The oral birth control pill works on different aspects of the female pattern hair loss, and also, if taken correctly, can prevent an unwanted pregnancy while on this other medication, spironolactone, that would be dangerous to the developing fetus. So they're often co-prescribed, and the individual can see good outcomes. So those are the medications that target hormones in the body that contribute to hair loss in women. I hope that was helpful, but in terms of setting your expectations, one of the goals of treatment that is important for you to understand is that sometimes maintenance of the way your hair is at the time of starting treatment equals success. So in other words, you may be on a medication, you may be on a treatment path, and you may not see any hair regrowth, any improved hair thickness. But importantly, over time, you are not developing progression of your hair loss. That's considered a success. So going in, setting that expectation from the get-go, you might not have hair regrowth or increased thickness, but you do have the opportunity with medications and management to slow progression to even more hair loss, even more noticeable areas of hair loss. The other aspect of treatment that is important for you to understand, because the hair cycle is a long process, you have to give these medications, they have to be trialed for a period of a minimum of 6 months before efficacy can be confirmed or refuted. So, you know, obviously nothing in dermatology works overnight. 6 months is a bare minimum before you could expect to see true effects. It's simply the rate of the hair cycle and everything, so you have to be patient with them. And also, the FDA approved treatment for female pattern hair loss is still going to be topical minoxidil foam. So that very likely, I mean, unless you have just a bad irritation to it, very likely should be continued to get you ongoing improvement. So those are some expectations, and I would say if you are a premenopausal woman, really the options that more likely would be considered are that are medications outside of just minoxidil are going to be spironolactone, 100 to 200 milligrams daily, in combination with minoxidil and an oral contraceptive pill. Those would be treatments to really target multiple arms of the hair loss process and get you best results if those medications are right for you. Get you the best results if those medications are right for you. If you're postmenopausal, then finasteride becomes more of an option to add on and a consideration. But again, only if that's right for you, only something you and your treating healthcare provider can determine. So I hope this video was helpful to you guys, because I really, I hear your questions, your concerns in the comments, and my heart goes out to you. Losing your hair is emotionally devastating. And I hope understanding some of the treatments is helpful to you in terms of having a more fruitful conversation with your healthcare provider. I know you have a very limited window of time with them, so I hope this video was kind of helpful and maybe setting some of your expectations even going in of what you might ask them. But if you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.